My name's Andrew Reeves. I'm a senior counsellor psychotherapist and an associate professor in the counselling professions of mental health. And one of the things that I've been interested in for many, many years in my practice, and I guess in my personal life too, is around male mental health and how men deal with and respond to kind of crises in their lives. So I worked for many years in a mental health crisis team, responding to people at that real severe end of distress, and also as a therapist where I saw kind of men in therapy rooms, individually and in groups, to try and deal with some of the issues that they have to contend with. I'm not claiming that mental health is a men-only issue. Clearly that would be ridiculous. Mental health is all of our issues, but I do think that there are particular challenges for men in dealing with mental health because of how they're taught to be and how they're taught to respond, kind of child rearing practices growing up, social messages about being strong, about conforming, about being stoic, about not expressing feelings. That means that for many men often, how they feel in response to difficulties in their lives gets turned inwards and then gets acted out in ways that are really unhelpful, are quite destructive, both for them, for others, and for society more generally. To put it in context, what does that look like? Well, we know statistically speaking that 4 men a day in the UK die through suicide, and that suicide is the biggest killer for men in the 25 to 50 age group. And it's worth just dwelling on those statistics a little bit because in a sense they're just numbers, but if you start to think about 4 men a day dying through suicide just in the UK, it's really not talked about. People don't mention it. People don't really know that they're sort of the numbers that we're having to face. And I remember going to a conference where somebody from the charity Campaign Against Living Miserably, the CALM, which is a fantastic charity aiming mental health support to young men, said that if 4 men's bodies were washed up on Britain's beaches every day, there would be a public health crisis and an absolute outcry. And I think that's right, there would be. But because suicide is still full of stigma, people don't talk about it, let alone talk about the wider mental health issues, it kind of goes under the radar. And so many boys, men are dying throughout the year because of feelings that they have and situations that they face that they don't know how to deal with because they've never been taught to. What I experience, of course, is that when men do come to counselling or do come to seek help, actually they're really good at it. There's this myth that men can't talk about their feelings, men don't know what to do, you can't help men around mental health. Well, that's just a load of nonsense. I've supported many, many hundreds of men over the years, and they can use the support really well. The challenge, of course, is getting them through the door. And we need to make some major changes in our mental health system, including counselling and psychotherapy services, to help map those services better onto the experiences of men so that they can begin to access those services. This isn't just about suicide prevention, of course. This is about how men behave, how men relate, how men are with each other, about reducing family violence, about reducing some of the awful excesses of behaviour that we've seen in the media that's quite rightly challenged. It's really important that men take responsibility for what they do and how they behave. It's also really important that society creates better opportunities for men to deal with their problems before they reach such a point where they become acted out and behaved in a way that causes enormous damage. My call is for a much better and informed discourse around men's mental health, a challenge and change to the way in which we bring up boys to make sure that they are encouraged to talk, they're encouraged to express their feelings. There's no shame in crying, there's no shame in being how they are, so that we begin to make real, important, embedded systemic differences for our society and for all people within it.